solutions. This is ABC7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC7. We always ask experts your questions every day at 3 to get answers for you in real time. Today, a massive cleanup effort in Lake Tahoe. Scuba divers have just finished their 72-mile journey. We'll have an update on their efforts and the plan for more underwater cleanups. Also, racial disparities in traffic stops. Our media partners at the San Francisco Standard will discuss a plan to ban SFPD officers from pulling people over for minor vehicle offenses. But first, many people now view COVID-related choices as binary. Masks, vaccines, restrictions, they work or they don't work. They're good or they're bad. But some doctors are increasingly warning that type of thinking is damaging to our health and to our society. Stanford researcher and infectious disease specialist Dr. Abrar Karan has strong views on this issue. He tweeted this message that got a lot of attention. Just because you weren't masked at one place does not negate that masking elsewhere still matters. It probably matters more, as you may be infected and not know it. Don't fall into the all or nothing trap. Dr. Karan joins us today. Thank you for your time.
Thanks so much for having me.
All right, so what is this all or nothing trap?
Yeah, so I think the key here is that it's like rolling a dice. Every time you do a different activity, there is obviously a chance that you can become exposed, and there's a chance you could become infected. You know, there will be people that have exposures that don't develop into full-blown clinical disease. There will be other exposures where you have a high exposure to the virus, a lot of virus in the air, and you may develop clinical disease, and that may take time. But the fact is that every time you meet up with somebody or every time you're in a public setting, there's a way for you to reduce the amount of infectious aerosol that you're spreading to those around you. There's also a way to reduce how much you're inhaling. And so that was sort of the idea behind the tweet, that saying, you know, even if you went to an event that was really important to you where you took your mask off, that doesn't mean that masking has no benefit. And in more mundane situations like going on public transit or grocery store, I would say keep your mask on.
So you're basically saying there's this constant risk-benefit equation for people, right? But all or nothing is kind of the opposite, and a lot of people seem to be thinking that way. And tell us how you think that's hurting them when they take that kind of an approach.
Well, I think that, you know, the key here, especially as a clinician, is that I just want to recognize that everyone is trying their best, right? We're basically over 2 years into this. People are getting exhausted, and it's just not feasible. And it hasn't been feasible even from the start to expect that people are going to mask up in every single setting and be perfect about every single intervention. Just like when we work with patients, we try to do the best that we can to develop a plan that will work. And sometimes people miss a medication, or sometimes people miss an appointment. You work within what people are able to do. And I think that's important to say that, you know, there's been some shaming I've noticed where people are saying, oh, I'm seeing people that are unmasked, or I'm seeing people that aren't doing everything perfectly. You just need enough people to do things enough of the time such that we can slow transmission down.
All right, that makes me feel a little bit better, because I kind of encountered this, I think. Someone saw my choice as inconsistent when I expressed my preference for a mask mandate on airplanes. They pointed out that I'm willing to unmask near 1 or 2 people at work. But, you know, to me, that wasn't necessarily inconsistent. It was kind of like making choices based on what's important and where I thought the greater risk was.
Absolutely. And remember, people have been making choices from the very beginning. There are people that didn't have a choice to stay home and they had to keep working. A lot of these were patients that we took care of. There was a lot of people that had to be there for loved ones, that had things come up in their own lives. There was obviously a lot of other things going on in the epidemic beyond just COVID that made it very stressful time for people. And so I think the main thing that we can do is continue to have empathy for people, give people the benefit of the doubt, and keep encouraging these very low cost interventions, like low-hanging fruit, whereby when people are able to do it. So I tell people, you know, upgrade your mask, wear the best mask you can. There are comfortable N95 models, many of them available, and do it where you can. So if you're going to be doing it on public transit, you're going to be doing it in certain workplace situations, the gym, if you're not doing like heavy cardio, there are situations. Just keep reducing your risk as much as possible. And if enough people do this consistently, we will slow down spread.
Right. Now, you do say public health and politicians have ruined one of the lowest hanging fruits, masking, that is, right, during the epidemic. How did they ruin it? Like, what was the messaging that was so wrong? I mean, what should it have been?
Definitely. So here there was a so looking back now, the messaging should have been very clear, especially early on, to say, even if we didn't have all of the data on how effective masking was going to be at a community level, we should not have discouraged people from masking. We should have said there's likely a benefit, especially if everyone's doing it consistently. There's no big cost to doing this. So please, at a community level, begin masking. Secondly, we already know from the healthcare setting that N95 masks work much better than cloth masks or surgical masks. They're designed to, that's what they're verified and cleared to do through NIOSH. So they should have been pushing N95s, making free supply available with comfortable models. Fourthly, they should have actually had fit testing available for people that can't achieve a good fit. In the hospital, we do fit testing, and many people have pointed out that, well, the masks aren't as effective if you're not fit tested. Fine. They should have had fit testing available for people that couldn't achieve a good seal. Then they should have had very clear communications with people to say, these are the settings where transmission is happening most effectively, indoors, crowds, wear your mask in these settings. They should have had mandates in those settings specifically and allowed people to unmask outdoors when they weren't close or in big crowds. And then additionally, as some people have pointed out, we should generate more data, because anytime you have an intervention, you should test that out, see if it's working well. And if it's not, then figure out ways to improve it. And so I'm all in favor of gathering more data. We should have more data on this. We don't. And again, we're going to run into this problem later this year. As the White House warned, we're expecting potentially 100 million Americans getting infected later this year. We should be doing all of those things now before we head into another surge, potentially later this year.
There are those who say, look, this message is coming too late. What good is it now? So what good is it now to shift?
I don't agree with that. I think, it's better late than never. We already know that, reinfections are a big problem. We know that there's new variants that are spreading around the world, spreading even here. Some of those are they're more transmissible. We haven't seen any that are more virulent or causing more severe disease, but that doesn't mean that we won't see that later this year. We saw that with Delta. And so I think that, the best time is to really be consistent is now, and to get the messaging out there, especially because we need people to start buying into public health and understanding and believing that public health officials have people's health in mind and nothing more than that.
Look, some doctors, and I don't know if this goes back to that all or nothing thing that you're seeing that you worry about, are now saying that mask mandates don't work. We're talking about reasonable doctors who say, they don't work because people wear cloth masks that are not protective, or they wear N95s or surgical but under their noses, so they wear it incorrectly. How do you view that perspective, that we shouldn't have mask mandates because people are not doing it right or they're not wearing the right mask?
Again, I'd push them on what do they mean by they don't work. First of all, there are some people that point out that we need to generate better data to figure out where they work and where they don't work. Now, if you don't have that data yet, it doesn't mean that that's proof to say that they don't work, because we have data showing that at least N95s, these high filtration masks, do work. I mean, I've worn one over 2 years, taking care of many COVID patients, never got infected. There's a reason we have these in place. If they didn't work, then why would we even have healthcare workers wearing them? So they do work. If people argue that the public could get better fit, sure, they can. And there are ways to do that from a public health standpoint. Then I would say, again, it's not an all or nothing. If many people are wearing these masks in very high risk settings, they will have an effect, especially in public crowding, in public areas that are crowded, such as transit. Transit I pick on specifically because this is what people need to do to get to work. They need to do this to go get groceries, to get medical appointments. People that can't afford to be traveling in private cars need to depend on public transit. So this was an area that I think was particularly disappointing to see mask mandates pulled back on. Again, I would say here is where you increase supply of the highest quality, best fitting masks. And remember, they have two effects. One is they protect you. And two is that if you're infected and you don't know it, and you maybe just start showing symptoms or aren't showing symptoms yet, they reduce the amount that you're exhaling to people around you. So they can protect those around you as well.
What do you think is wrong with the you do you approach that we're seeing a lot of?
Yeah, so the you do you approach is really the antithesis of public health, right? It's the antithesis of community effort. And it essentially is saying that if you have all of the resources that you need, then you can stay protected. That was true even early on in 2020, when you could essentially work from home. You had access to physicians. You had access to getting the vaccine as soon as it came out. Now you may have access to Paxlovid if you need it. But that's not true for everybody. And that's especially not true for people who aren't able to work from home, who don't have a primary care doctor, who may not have the level of health literacy that some other people have to even know that they have a drug, an antiviral drug that could be helping them. So public health cannot just rely on individuals figuring out for themselves. And, you know, when clinicians or other people are saying that this is what they did, they're speaking from a viewpoint that most average people don't have, especially if you don't have expertise in the medical field.
All right, Dr. Abrar Karan, Stanford researcher and infectious disease specialist, thank you so much for your time and insight. Appreciate it.
Thanks for having me.
Coming up next, cleaning up Lake Tahoe. Scuba divers just finished a year-long mission to collect trash. How much and what they found? We'll be right back. All right, we'll be right back, folks. One year ago, a team of scuba divers set out to remove thousands of pounds of litter from Lake Tahoe. Well, it's mission accomplished today after cleaning all 72 miles of the shoreline. Colin West, founder of Clean Up the Lake, joins us now with more on this massive effort. Colin, congratulations. A whole year, you did it.
Thank you so much. It's pretty surreal to be at the finish line, and having pulled out over 25,280 pounds of small litter items from under the surface of Tahoe. It's been a phenomenal effort by a group of unstoppable individuals that I'm honored to work with.
25,000 pounds? Okay. What was in that 25,000 pounds? Like, what kind of trash did you collect? What was in there?
You know, we had all sorts of items. I think, of course, we see the plastic water bottles, the aluminum beer cans, the different kinds of construction items and materials that unfortunately fall off docks or are really left behind because of the impacts human beings have from living in this basin. But we found some other interesting items as well. So some 1980s film cameras with film still in them, even some cordless phones, a BlackBerry, and even a few things, you know, as Jacques Cousteau said, the world wasn't quite ready for what was under the surface of Tahoe. There's a couple things that, you know, if you catch me off the news, maybe I'll share a few items off the record.
Okay. Well, look, how is it that it all ended up there? I mean, we recreate on the lake, right? Lucky enough to have been there. It's gorgeous. I mean, I get the small trash, but you're talking about stuff that I don't even know how it would end up there unless somebody intentionally dumped. Do they do that?
You know, it's a great question. And of course, there is some areas of intentional dumping, even industrial dumping of things like 20 tires in one dive, which doesn't get there accidentally. And then, yeah, you can see beer cans or 5 or 6 different beer bottles of the same brand in one small area that you know is intentional. But I think what a lot of people don't think of, and they go quick to say how disgusting it is that we found this much litter and who could ever do this. But I think a lot of people forget that, you know, by being here, by living in the basin, we have an impact. And I would say over 90% of the litter that we pull out are things that are either accidental or that are simply falling in the lake because we are present here in this beautiful part of our world. Why is
it so important to the health of the lake to get rid of the trash?
Absolutely. So, you know, there's a lot of different effects that we know that litter and trash can have being present in the waters, from such things as microplastics and tires or other plastics that break down and cause those microplastics, to other factors and toxins that could leach from other waste that is left inside this beautiful big blue lake we have in the Sierras.
How does lake trash diving work, right? I mean, I see you got your scuba suit, but like, how do you go in? Like, how do you get the stuff out? Do you carry bins or baskets, or do you hold the trash in your hands and then somebody pulls you out? How does that work?
It's an absolutely fantastic question that took time for me to learn how to answer. You know, through trial and error, our organization went out to do scuba cleanups, and it would be as simple as finding a tire or an anchor 15 to 20 feet down and eventually looking up and thinking, I don't want to carry this anymore. Yeah. You know, and then developing weighted rope systems that we use to pull those tires out of the water, or using our free divers to use custom hand signals to communicate with divers and GPS pinpoint items to lift out our mesh bags when we fill them up with small litter. And then we have jet skiers who are GPS pinpointing hot spots for litter items, heavy lift 500-pound trash items we need to come back for in a year or two. So a lot of logistics and protocols that went into this.
So it sounds like by doing this, your physical strength improved as well as your communication skills and understanding of physics. Is that right?
Very, very accurate. I've been training to become I actually just finished my scuba instructor, which was about 3 weeks in a room studying physics, as you said, and certainly feel like I can eat a few extra desserts here and there when you're kicking 72 miles around the lake.
Let me ask you, how deep could you go? I mean, that lake is famous for being super clear. Could you see to the bottom? Were you able to go to the bottom and get the stuff out, or no?
Good question. I would not want to go to the bottom on recreational scuba gear, as you may never have a chance to interview me again.
Yeah,
at 1,600. Exactly, 1,600 feet deep, a bit too deep for a diver to go in kind of standard scuba. So we went on this project down to about 25 feet because litter was accumulating closer to shore. However, this year we're excited to announce 4 different lakes that we're going to clean up. And on a few of those, we're going to be going deeper to closer to about 100 feet, which is our kind of max limit for recreational divers or even professional divers at altitude, which is where these lakes are, of course, in the Sierras.
Wow. Okay, so it sounds like you got a couple of projects coming up, and are you going to need funding? Like, who's funding this?
We are. So, of course, for the 72-mile cleanup, we've been so grateful for the support from Tahoe Fund and Tahoe Blue Vodka, Nevada State, Martis Fund, and all these other amazing community grant-giving organizations. But we do have some great partners moving forward, like Boatworks Mall and Tahoe Truckee Lumber Company, but we still are short some funding to do the work that we need to do this year. So anyone can go to cleanupthelake.org/donate, or get our contact information on our website or social media, and you can give me a call directly and talk about how to partner with Clean Up the Lake to make a difference in our environment.
All right, Colin West, good luck with your next dive, and Donner Lake or wherever that may be. Thank you so much for your efforts to clean up the Sierra Lakes. Take care.
Thank you so much for having me.
All right, good luck. Coming up next, we'll talk about police reform. It is taking shape in various ways across the country, and a San Francisco police commissioner wants to ban officers from pulling people over for certain traffic offenses. We'll talk about that when we come back. All right, we'll be right back, everybody. Stick around. Welcome back. A San Francisco police commissioner is proposing a ban on minor traffic stops. Police say these stops can help take guns or drugs off the streets, but people against the practice say Black and Latino drivers are unfairly pulled over at disproportionately high rates. Our media partner, the San Francisco Standard, has been digging into the data. The Standard's reporter, Michael Barba, joins us now. Michael, thanks for coming on the show. Look, at issue are what's called pretextual stops. What do we mean by that?
Thanks for having me. So a pretext stop is when police pull someone over for usually a minor vehicle traffic offense, like having a broken taillight. And what the officers are really going after is they want to investigate the person for an unrelated crime, like having guns or drugs in the car or something like that.
Is this common practice in law enforcement?
It's hard to say if it's common. Traffic stops are certainly common, although they've been declining. As to exactly how many pretext stops there are, it's hard to say because it's more of a matter of analysis.
Right. Critics say the problem is, it's not being done fairly because Latino and Black drivers are pulled over at higher rates. So the Standard, I know, looked into the numbers. Is that substantiated?
So what we're really seeing is that the issue is that there are stark disparities in traffic stop data. So right now in San Francisco, or last year actually, Black people were 4 times as likely to be pulled over for a vehicle offense in San Francisco compared to white drivers. So there are really stark disparities, and depending on how you slice the data, it really just gets even worse. I think back in 2019, for a particular type of vehicle offenses, the disparities were as high as 10 times as likely for Black drivers. And that's the problem that this policy is trying to address.
Okay. So a San Francisco police commissioner wants to address it by banning pretext stops. Tell us what the proposal is and what that would mean.
The proposal is really two-pronged. So it's trying to address the pretext stop issue. One way it would do that is by just making low-level traffic stops off limits altogether for officers. So police would still be able to issue a citation in the mail. They just wouldn't be able to pull over the driver and stop them right then and there. The second prong in the proposal is to limit the types of questions that officers can ask drivers once they pull them over. So if they were to make a traffic stop, they wouldn't be able to. The idea is really to stop them from trying to investigate those unrelated crimes that they might not have reasonable suspicion to investigate.
Would there be any exceptions given within this proposal that would still allow officers to make such stops, like if they noticed this or if they saw that?
Yeah, I believe that there are exceptions, particularly around crimes that are serious or potentially deadly. So if an officer has a reason to believe that this person might be a threat to somebody, they can certainly still stop them for that and then issue the citation for the vehicle offense as well.
Has San Francisco's police chief or perhaps the mayor weighed in on this proposal?
The police chief told me previously in an interview, not directly addressing the proposal, but just the idea of pretext stops overall. He said that, the bottom line is nothing is off the table. He's very well aware of the disparities in traffic stop data. And he says that what the department has been doing isn't working and something needs to change to address the disparities is the bottom line.
Okay. Look, in cities that have banned officers from making some of these pretext stops or traffic stops, what has the impact been on reducing racial disparities?
I think it's all too soon to say. The cities that have taken action recently have done so in just the last year, maybe. So Los Angeles just within the last couple months took some steps to limit pretext stops. They required officers to have specific information before making a pretext stop. In Philadelphia, they did what San Francisco is considering here, and they just banned low-level traffic stops altogether. But this is all really fluid and still has yet to be examined.
All right, we have about 30 seconds, but I'd love for you to tell us what is the next step. Like, is there a public hearing? Will people be able to weigh in? And then when might the vote be?
Yeah, so this is kind of an unusual process, the way the police commission is going to hear this policy proposal. It's going to start on Wednesday when the proposal will be introduced. And it's actually going to be a series of public hearings that follow where people will have a chance to weigh in and give their views on the proposal. The idea is to have this culminating in a vote in the fall where the police commission will decide whether to adopt the policy. And then there's a whole labor negotiations process that'll happen afterwards. So we're really just at the beginning stages of this proposal right now.
All right, Michael Barba, don't go away. We can continue to chat on Facebook Live. Got to take a short break, but we have links to the San Francisco Standard's other original reporting at abc7news.com. To watch more ABC7 segments featuring the Standard's city-focused journalism, check out our ABC7 Bay Area streaming TV app. We'll be right back. All right, Michael, if you've got a couple more minutes, we can wrap it up here on Facebook Live. I'm wondering, although I do know you mentioned, the cities that have stopped this have just recently done so, so this is all pretty new, but was there any negative impact reported by those cities? For example, police saying that they've lowered their case solving or clearance rate, anything like that as a result of stopping these pretext stops?
I'm not sure about that, but what I can tell you is that what you hear police saying all over is that these are an invaluable tool for taking guns and drugs off the streets. Certainly, police unions do not want their officers restricted or to have one of the tools in their toolkits taken away from them. So police definitely think that this is a valuable tool. The issue that they're coming up against is these stark disparities and advocates who are saying that something needs to be done to reduce them.
Every initiative, of course, has its pros and cons to consider. I'm just wondering about, like, if they, you mentioned the proposal could mean that instead of stopping you, they might just mail you a ticket, right? Let's say I did an illegal U-turn or something. But if they don't stop you, one downside, couldn't it be like that you don't get a chance to explain yourself or, like, talk your way out of it because let's say you had a good reason for doing what you did?
Yeah, that's certainly true. I think the flip side of that, though, is that if officers are stopping people for a broken taillight and just using that as a pretext to investigate these other potential crimes that people are having, it is leading to these disparate impacts that advocates say erodes trust between the police and the communities, right?
Yeah, absolutely. Yeah, I mean, there's just so many different, complexities to this. So they'll hash it out, and I'm sure you'll be continuing to report on this. So thank you so much, Michael Barba. Really appreciate your time and insight today.
Thank you.
All right, folks. 10 seconds coming back out, and we'll finish the show. So glad you're here today.
7, 6, 5 seconds.
Thanks for joining us on this interactive show, Getting Answers today. We'll be here every weekday at 3, so see you back here tomorrow. Bye-bye.